Hi everyone. Today we are going to see this particular case note. This case note is about a patient named Vineyard. You can say, sorry. One minute, please. Yeah. Miss Vineyard is a patient in your care at a refuge center, a women's refuge center. Now she's 6 weeks pregnant with her first child. It's her primi gravida. She presented 2 days ago. It means today it's age 2 days ago. That is on 6th. So this is a summary. Requesting her help for her substance abuse problems. She reports a desire to reduce or cease her alcohol consumption and a desire to reduce her drug use. No desire has been indicated to decrease or stop cigarette use. She now wishes to be discharged, but will require ongoing support through her pregnancy. Now, we have got enough idea from here. This is something which we can call it as a summary of the case note summary. So I can say this is something like that. Now, where is she accommodated right now? She is discharged from this particular place. Her condition is she is pregnant, 6 weeks pregnant with the first child. She has substance abuse problems. She needs to, she desires to reduce her drug abuse, alcohol consumption, but not to quit smoking. Now she will require ongoing support throughout her pregnancy. This is what she needs. Now, patient name is important, age is important, admission date is important, diagnosis important, discharge date is important. All these are important here. When I go with this thing, the requirement is after discharge, we need the service of a community mental health nurse, at least for 2 weeks. And patient wishes to continue to live, this is not that much important there. Psychiatric support needed for depression. Yeah, that's why we are going to give her with this thing. We need her to be a part of programs, methadone programs and Alcoholic Anonymous programs. And we do have a schedule of first trimester ultrasound at 2 weeks. Maternal health clinic appointment is also needed. So these are the plan after her leaving from the refuge center. Now the reason for admission. Now this is the reason. Now she got pregnancy test confirmed 2 days ago. That's on the day before her admission. Reports pain in lower back, weight loss, 6 kg over 2 months. So this is something severe, serious. So we have to see that. So you need to have an intervention there. Memory loss, No, tingling test. No, not that thing. So excessive worry and hallucination. Yes. So insomnia, hallucination is something important, and depression is something which is important. Pains, appetite, all these things are common symptoms. We just need to go with the abnormal symptoms here. Now, when the treatment patient monitored for blood test, HIV/AIDS, no need. I think it is not needed here. Counseled regarding nutrition and pregnancy. Yes, we need. Counseled regarding HIV and STD risk. Okay, we need it. Discuss the possibility of rehab clinic for driving out. So you need to educate the patient that there is, if you are not coming out of the situation, you need to be kept in rehabilitation. It's somewhat like a prison. You have to be there. So if you are not coping up with the situation, you may have to go to the rehab. So that is the warning. So lifestyle, she has a small habit of smoking 30 to 40 cigarettes per day, and she started smoking at the age of 15, and she used drugs like cannabis, amphetamines, cocaine, heroin, and all these things started about 16 years old. He injects heroin and occasionally shares infecting equipment. Alcohol 8 units a day, maximum 15 units a day. Started drinking at the age of 16, lives with her friend. Her name is Sophie, on her sofa. No contact with parents, just limited suicidal thoughts are there, self-harm was there in the past, but she has never seen a psychiatrist. There's a lot of information given in this particular thing. We need to select which are related and which all we can see. So I think we can start with a correction here. So the date is 8th January. It's correct. Miss Lucy Ban, it is not Van, the registered nurse, Community Health Center. Fine. Mr. Ban, Miss Ban it is, it's not Ban. So Miss Amy Vineyard, age 25, it's correct. Writing to refer Miss Amy Vineyard, a 6 weeks pregnant woman. It is woman there. It is not, sorry. It's not a woman. It is a woman. An it is. Requires ongoing care and so throughout her pregnancy following her discharge. Okay. Okay, this is okay, fine. Miss Vineyard was admitted to the hospital on 6 January 2019 due to concern regarding her pregnancy. Okay. She has substance abuse problems and psychological problems such as memory loss, excessive worry, hallucinations, depressions. She reported her interest to cease alcohol consumption and drug use. So this is something which we need. We don't need it here because this is not the continuation of the first sentence. So she he got admitted to the hospital on 6th January 2019. So after that, the connection, this is not connecting to this sentence. So I think that this is better connecting to this sentence during hospitalization. So I think this is somewhere we have lost the connection there. So up to this point, it was okay. From there, you can see that this sentence is not going ahead with this sentence, and this sentence is not going ahead with the previous sentence. Now we have total mess up here in this paragraph. So this paragraph is to be reconsidered. Now I move on to what happened during the hospitalization. During hospitalization, Miss Vineyard was monitored and blood test, which is okay, fine. So we don't need this information. So if we have found something relevant, if I have found HIV positive, then this would have been good. So blood test for STD, yes, we don't need it, but we can say she was educated regarding these things. So that was counseling regarding these diseases and education regarding the nutrition in pregnancy. As she has been 6 weeks weight loss, okay, you can add that. So nutrition and counseling for STD, sexually transmitted diseases, are relevant there. Miss Vineyard lives with her friends and she has a habit of cigarette smoking and consuming alcohol. Yes, how much cigarette she takes and how much alcohol she takes. Is she a heavy drinker? If she's having a habit of smoking more number of cigarettes, this is something crucial. How severe is her substance abuse? So this is something very crucial. So in order to understand the severity of the substance abuse, I need to say how many cigarettes is she a heavy smoker? Can he quit smoking? Now from the case note we can understand, even though she agreed to discontinue the drug abuse, she is not willing to quit smoking. So that's something relevant. We need to go with the number of cigarettes, at least in the brackets we can say. Now we have to say the units of alcohol too. Now we can say that drug use are there, including cannabis. Okay, it's not heroin. It is, the spelling of heroin is different, so it's not heroin. Okay, so we need to say the correct spelling. She has suicidal thoughts, self-harm in the past. So when you say in the past, you cannot use has. So she had suicidal thoughts in the past for which she never seen a psychiatrist. This sentence is actually wrong because we can say she has a history of suicidal thoughts and self-harm. So that is something. And she has never seen a psychiatrist. You need to merge these two sentences. In order to merge this thing, you can say, even though she has a history of suicidal thoughts and self-harm in the past, we don't need history means in the past. So even though she has a history of suicidal thoughts and self-harm, we can say self-harm. So it's one word. You cannot use it like this. You have to use self-harm. So that is something correct. She has never seen a psychiatrist, or she has not yet seen a psychiatrist. So that's the correct sentence. Ms. Vineyard requires daily community mental health nurse support for another 2 weeks. Okay, so that's okay. She also needs psychiatric support for her depression. So this is irrelevant because already this is there. If you are giving community mental health nursing support, she can assess or he can assess what is going on regarding depression and all. And encourage her to attend methadone programs and alcoholic anonymous programs. So this A and A should be capital here because it is said like that. We have it is written like that everywhere. So I think it is we call it AA. That is a universal abbreviation of alcoholic anonymous. So I think that it should be written in capital because it's a name which has to be shortened. Okay, and now it's important it's important that she needs maternal hand transfer stomach. So you can say of not, or please not, or kindly not, something like that there. instead of it is impounded. So it becomes so simple of notch. That's a good thing there if you use it. And if you have any queries, please do not hesitate to contact me. You are sincerely, Charles Nurse. So this is the letter correction, and we do have some spelling mistakes here, programs, then psychiatry, this C it is, okay. Okay, now we have said that you are sincerely charged nurse, and you have to go with this space. There is a space sent tilde women's refuge sender. So it is better to write that thing there so that we can complete it. So we have a model answer here. 8 January, Lucy Band registered nurse community health center, sent tilde. Miss Baramy Vineyard, writing to introduce Miss Amy Vineyard, who has been diagnosed with pregnant substance abuse. She requires ongoing care and support throughout her pregnancy and is being discharged today. So she's been diagnosed with pregnant substance abuse, diagnosis there. What she requires, ongoing care and support throughout her pregnancy. She needs your support all through her pregnancy, and now she's being discharged today. Who is she? She lives with her friend and has limited contacts with her parents. She has been a heavy smoker, so that's written here. So 30 to 40 cigarettes for the past 6 years. How long she has been? So for the past 6 years, she has been and has a habit of consuming alcohol on an average 8 units per day. From the age of 16, she has also been using drugs, including cannabis. So we don't need to mention all the names of these drugs, including cannabis. That's it. So that's something serious. She also has a history of suicidal thought and self-harm, but has not yet consulted his psychiatrist. So she has not yet consulted a psychiatrist, not till now. Ms. Vineyard was tested positive for pregnancy on 5th January. So she was tested positive and got admitted to our care the very next day. She was seen deeply concerned. So objectively, what we saw is that she was deeply concerned and she was depressed about her condition. She also has complained of insomnia and her verbalization. She reported that she had insomnia and hallucinations. At our care, we provided her with nutritional education. So I think nutritional education and counseling regarding sexuality, a lot of things were there. So nutritional education for weight loss. She has lost around 6 kg weight in around 2 months. So I think that is the reason why we gave nutritional education. So for what reason we gave nutritional education is secondary, but what we have given is that we have given nutritional education, and we gave counseling regarding sexually transmitted diseases and HIV. So a lot of things were there. So I cannot include every data like that. So I have selected some of the data and presented it. And now from the notes, I have selected this although. So right now, so we have, she came to our hospital. This was her condition, and this is what we gave her. And right now, she agreed to stop her substance abuse, but she's still hesitant to quit smoking. So this is something which we need to know. So she came, she was like this. And then we have provided some of this thing, and right now she is in this condition. Now what you have to do is that we appreciate it if you could provide her community mental health nursing support daily, every day for at least 2 weeks. So I think minimum 2 weeks. You can go ahead, you can change it to at least at least 2 weeks. Kindly encourage her to attend methadone programs and Alcoholics Anonymous programs meetings. Please note that her first trimester ultrasound is in 2 weeks. So, some students may ask whether we need to write 6-week pregnant in the beginning. So I think it is understood from here that her first trimester ultrasound is in 2 weeks. That means we can calculate the pregnancy in that way too. And she needs maternal health clinic appointments periodically as per the time. So we need to go ahead with a regular maternal health clinic appointments. If you have any further queries regarding her condition, so I can say regarding Miss Vineyard's condition, please feel free to contact me. Yours sincerely, Nurse, St. Kilda Women's Refuge Center. Once again, I say this is just a model. This is not a perfect answer. You may find some problems here and there. So, so please consider this as just as a sample. Okay, thank you. And that's all. Have a nice day.